windy too.
It's not raining here yet. I don't think.
It's coming your way. Oh, well, I'm in Queens, so maybe
What
it's
part?
moving.
What part?
Bayside.
Oh, okay.
So maybe it's coming that way.
Dr. Allison, you could take it away because we're now live.
Good evening, everybody. Today we have a bonus session. I'm looking forward to this. I think it's going to be great. Last week's show was wonderful where we talked about COVID and the impact on children as they're going back to school. Today, we're actually going to focus on the adults. We're going to focus on unemployment, resources and benefits, and who better than to have but people from Northwell's Medical Legal Partnership. So we first have Curlin Flowers, JD. Curlin, could you give us a few words and tell us about yourself?
Hi, everyone. My name is Curlin Flowers. I'm an attorney for the Medical Legal Partnership between Northwell and Hofstra Law. I've been practicing for 13 years as an attorney, and I'm really excited to be here with you guys today.
Great, thank you so much. And we also have with us today licensed social worker Tyra Bosigo. She's a part of our Medical Legal Partnership as well. So Tyra, can you give us a few words and tell us about yourself?
Sure. So I'm the social worker for the Medical Legal Partnership. Currently, we are located in 2 internal medicine sites at Northwell and 1 pediatric site. So we're screening patients for social and legal needs, and then we are intervening and assisting where we can. So very excited to be here tonight.
We're excited to have you, and we will be back again next week, September 3rd, with our show where we'll be focusing on Black business owners. So please join us again next week for that. And now I will pass it over to my good doctor, sister girlfriend.
Hi, everyone. My name is Dr. Omolara Uwemedimo. I am a pediatrician and professor at Northwell Health, and it's super, super exciting to be able to talk to all of you. We never really get the chance in our offices to be able to speak to so many people at once, and so it's truly awesome. But I wanted to introduce this as one of the leaders within our Medical Legal Partnership, is really being able to make sure that it's clear. Some of you might be wondering why Northwell Health, which is a healthcare system, is talking about unemployment and employment legal rights. It may not make that big of a connection, but one of the really good things for you, for all of you who aren't aware, is that what we found is that rather than medicines and clinical visits, what we know for the majority of our health is actually determined by the social conditions that we live, work, and play in, and the needs that we have in those areas. And so what we're really excited to do is that within our clinical setting, having a medical legal partnership allowed for lawyers and social workers to be able to address those needs. And we found that people actually improve in their health and improve in their wellness when those needs are met, such as food and housing. And so today we wanted to talk about employment and 2 different areas that we believe are affecting us. The first one being those who are employed, and really making sure that legally we know our rights and we know what we have rights to in terms of our jobs, and especially in this time period where COVID is prevalent, and understanding that we may have health risk, and just being very aware and attuned to that. So we're going to talk about that. And then in addition, what we'd like to talk about is, of course, the huge increase of unemployment that we're seeing across so many children, across so many families and individuals. And so we want to be able to make sure that all of us are really aware of what is out there, what do we have that's available to us to help us through this difficult time. And we have these amazing 2 individuals who I'm really excited to hear from. And I have my notepad as well. So I ask you guys to get a pen, paper, make sure you're taking notes, because they have a lot of gems that they'll be sharing. So I am going to pass it off first to Tyra Bosigo, who is our licensed clinical social worker, and basically our just rock in terms of helping us make sure that people's social needs are getting met, and that then their health is a lot better of it. So Tyra, thank you so much.
Thank you for that introduction. So I will go ahead and share my screen and I'll begin our presentation. Oh, I think maybe I need to be co-host or host. It's disabled.
Can you share now?
Yeah. Right. All right, can you guys all see my screen? Perfect, okay. So just to kind of give everyone, I guess, some background information before we kind of get started, just to kind of give some context to kind of some of the things that we're seeing. Across the nation in July 2020, the unemployment rate was at 10.2%, down from 14.7 in April, which I think was probably the worst month for employment. We've added 1.8 million jobs during the month of July, but most of the jobs that were lost due to COVID have yet to recover. And currently, more than 30 million people are receiving some form of unemployment. And since the CARES Act expired in July, a lot of people have really been pushed to the brink, not having that extra $600, per week. So to bring it kind of into our home state in New York, the unemployment rate for July was 16%. New York City, for the 5 boroughs, they were the hardest hit with an unemployment rate of 20%. And then, just want to go back. And then for Long Island, we saw an increase actually from June to July. We saw a 1% increase in unemployment. So total 215,000 people are unemployed currently on Long Island. So what does this mean for our communities, right? So Black workers are disproportionately found among those who are essential workers. So they are still having to kind of go into work. They're still risking their health and that of their families, especially if they have family members at home who have any underlying health conditions. A lot of times maybe they're not able to sustain social distance. And even if they themselves have underlying health conditions, they're constantly putting themselves at risk. And so while kind of in the short term, this protects them from job loss, it also exposes them to contracting COVID. So Black workers make up about 1 in 9 workers overall. They represent 11% of our workforce, but they make up about 1 in 6 of all frontline industry workers. They also have the highest unemployment rate compared to any other racial or ethnic groups. The unemployment rate for Hispanic workers dropped from 14.5% in June to 17.5% in May. The unemployment rate for Asian workers dropped to 13.8 from 15%. And so this graph here just kind of gives you another visual of what's going on here. So right now, the gap between African American and white workers is at a 5-year high. So currently, African Americans are unemployed at a 15.4% rate, while whites are unemployed at a 10.1% rate. So, and also to kind of give a little bit more context, the unemployment rate for New York was 3.8% in July of last year. So it's grown considerably. And this pandemic didn't create this disparity. We were actually at a 50-year low prior to COVID. But even with those numbers, Black workers were still 2 times as likely to be unemployed than their white counterparts. And that even accounts when we're talking about education level. So this has undoubtedly created issues when it comes to housing, food, paying bills. All of these things are at a crisis level. And of course, these are systemic issues that, we may not be able to solve in this forum. But just to kind of give you some context as to what is going on and to kind of paint the picture of what's happening in our country, how we kind of got here, and what are some things that we can do now. So I know a lot of people know about the CARES Act. It expired at the end of July. I just put some information in here about stimulus payments that we received, and some of the unemployment benefits that had expanded through this economic relief bill. So currently, right now, we're almost like in a state of limbo where the CARES Act expired July 31st, and we have yet to be to kind of implement any new stimulus bill. So the HEALS Act is Republican, HEROES Act is Democrat. Currently, I just checked the status the other day, the HEROES Act has actually progressed a bit further than the HEALS Act. So I just kind of wanted to lay this out for everyone just to kind of see what are some of the things that are being proposed, what are some of the benefits that we, may receive from any one of these bills, and what are some of the things that they are not addressing. So for the HEALS Act, it's a $1 trillion economic stimulus bill. Families would be able to receive a $500 benefit for dependents with no age limit. The increase in unemployment, aside from whatever you're getting from state, the federal government would then put in $200 extra per week, and then up to $500 per week to kind of match your 70% of whatever wages you were making prior to being unemployed. And those benefits would then extend until December 31st. So, we're already going into September, so it's kind of short term, and I'm not sure if they'd be open to extending that, but it would give folks at least an extra $200. However, one of the biggest issues with this bill is that it does not address eviction in any way, shape, or form. So for those folks who are at risk of being evicted, this bill would not, address it in any way. So for the HEROES Act, which is Democrat, this is the one that I was saying has already passed the House and is kind of moving along. This is a $3 trillion economic stimulus act. It kind of builds upon what the CARES Act already started. Again, we would be eligible, for $1,200 stimulus payments. Families would receive an extra $1,200 for their dependents with a maximum of 3. So for those families who have more than 3 children or more than 3 dependents, they wouldn't get any additional money for them. The unemployment benefits would be the same as the CARES Act. So that's including gig workers, independent contractors, part-time, self-employed, Uber drivers and the like. And those benefits would expand to January 2020 for most workers, and kind of expand through March for those gig workers, because for them, it's a little bit more difficult to return to work. Again, we get Paycheck Protection Program, and it does address eviction protection. So it expands to cover nearly all properties in the US, and it kind of extends the moratorium on evictions for an additional 12 months, which means those folks who were at risk of being evicted would have a little bit more of a reprieve to kind of regroup and figure out what their next steps are. It also puts money into housing programs, so housing vouchers that, folks in the shelter system are receiving. That, that money would be put into that, and also into rental assistance. So what are some next steps? If you have not done so, file for unemployment. I mean, if you have any questions about eligibility, if you've been denied benefits, we'd be more than happy to assist if we can. If you're looking for a job currently, I just listed some tips. Cast a wide net. There are a lot of people looking for jobs right now, and the competition can be stiff. So applying for multiple jobs, consider different jobs that maybe you've applied for in the past, or maybe in the past you may not have thought to apply to. Try applying to them now and see what happens. Broadening your options can really increase your odds of finding a job. Update your resume, update your LinkedIn profile, prepare for interviews, network if you can. I know it's really hard to do that when we're all virtual. But I think it's more, being creative and trying to think outside the box when it comes to how can we network and let people know that we are ready and willing to work and that we are looking for something. Also look into gig work, places like Upwork or Fiverr. If you're great at editing papers, if you speak another language and you can translate documents, there are folks that are always looking for assistance with that. And there are some companies that are hiring, such as Amazon, UPS, and FedEx. I was a little bit conflicted with adding some of these jobs on here because I felt as if I was offering the solution, or offering the problem as also the solution. A few minutes ago, I talked about how people of color are oftentimes those frontline industry workers. And they are the essential workers who are constantly putting themselves at risk by showing up to work to make a living and potentially contracting COVID. So, but at the same time, I don't want to take away someone's opportunity to make extra money to bridge the gap if need be. So I think it's best to kind of let you all know what the options are. And obviously each one of you would have to kind of gauge your level of comfortability, your health status, and whether or not you're willing to take that risk or not. I also listed the Department of Labor's website. They do have some job listings of companies that are looking to hire immediately. And I also think, if at all possible, now may be a good time to think about bolstering your qualifications, upping your education, polishing your skills, and thinking a little bit more strategically about what are my next steps going to be. It may, if you have unemployment and you're okay, maybe it's not just so much about finding another job. Maybe it's about thinking, what's my career going to look like? Where do I want to be in 5 years from now? And maybe taking the time, given that everything is virtual right now, to go back to school, to maybe finish that degree, to maybe earn a certificate, or something along those lines. So I think that a lot of folks are thinking about that, and I think that that's, it's a great time to do it. So I did list a few resources here if you're interested in kind of polishing some skills or learning some new ones to kind of help you re-enter the workforce. And then I also listed some additional resources. So our team put together a resource guide. We have an English version and a Spanish version. So I put the link here if you guys are interested in looking at that. There may be some additional resources, especially when it comes to food, finding food in your community. If anyone has housing issues or anything like that, it may be a good resource for you all. And I'd want to put in a plug to fill out the 2020 census if you have not already done so, and of course vote. Also, in terms of filing for unemployment, if you do speak another language, Chinese or Spanish, there is an organization, Asians American for Equality, who will help you fill out your unemployment application in your native language. And then I also wanted to add in here Documented, which is a new weekly immigration newsletter that goes out. There's also question and answer sessions. You can ask questions from immigration attorneys, professors, and other experts if you have any questions on immigration and what are your rights, and how any of this may or may not affect you. So you can download the WhatsApp for free, and you can get a weekly copy of this newsletter. And then I will let Curlan take it away.
Thank you, Tyra. So I thought it would be important for us, if you are working, you may have some questions about what your rights are. And I started by just listing some of the acts, some of the laws that you may need to refer to see what options you have. And then I followed it up with some frequently asked questions. So the first act I listed was the Family Medical Leave Act, and you might be familiar with that. That's the FMLA, where you can get 12 weeks of unpaid leave to care for a family member with serious health conditions. But you have to be working for at least 1 year with the company and have at least 1,250 hours during the year. And the employer must have at least 50 employees, and the employees must be 75 miles within the employer's work site. The next act is the new act that was passed it's the Families First Coronavirus Respond Act, or the FFCRA. You can get 2 weeks paid time off during any quarantine time. And then for the next 10 weeks, you can get 2/3 of your normal pay. So you can use this act, you could put this act in force for different situations, which I'll list later. Your employer should have under 500 employees, and you can be working full-time or part-time with this employer for at least 30 days. The OSHA Act, or the Occupational Safety and Health Act, This act is, it's set forth so that the employers are required to furnish a place of employment that's free of hazards or likely to cause physical harm. So many people are familiar with this act, and I'll tell you how it plays into our options. Also, the New York State Paid Family Leave Act. That act is for part-time or full-time employees. Your employer must have 100 or more employees where you get 56 hours of paid time off. If you have 5 to 99 employees, you get 40 hours of paid time off, or if they're less than 4 employees, you can get 40 hours of unpaid time off. And you earn, for every 30 hours you work, you earn an hour of time off. Let's see, and also there is the New York City, some people work in the city, there's also the New York City Paid Safe and Sick Leave Law. That one, with employer should have 5 or more employees, you can get 80 hours. If you work 80 hours or more in a calendar year, you can also benefit from this act. You get 40 hours after the first 120 days of employment. I just want to mention that all of these acts are applicable no matter, regardless of your immigration status. So if you have a job and you fit one of these categories, if you've worked for a year, if you've worked for 50 hours, if you fit in any of these categories, it applies to you. So you shouldn't worry about whether it applies to you based on immigration status at all. So the first question we might ask, we can advance, right? If I'm quarantined because of COVID-19, am I entitled to paid time off? So if your employer has fewer than 500 employees, we can use the Families First Coronavirus Act, Response Act, and you can get 2 weeks capped at 80 hours of paid sick leave. But you may not, if you're not able to telework, you can take advantage of that. But if you are, your employer can ask you to work from home or telework. The next question I have is, can my employer require that I use my sick time to quarantine? And yes, they can require that you use sick time that you have saved or you have built up before the coronavirus. They can have you use that time, and then you can use your sick time under the FFCRA. But they have to pay you for the first 14 days, and then you can use other time to make up for if you need to stay home longer. Can you refuse to go to work if you feel at risk for contracting COVID-19? Probably not. But you might be able to, if you can create, you can craft an argument, I guess I could say it that way. If your employer is creating an unsafe working condition by not following certain rules and not quarantining others that may have contracted COVID-19, it might be a violation of the OSHA Act because they're creating a harmful environment. If you're part of a higher risk group, your employer should be able to accommodate you. If you don't want to be around many coworkers, if you're feeling like your desks are not 6 feet apart and your employer's not doing certain things, you can ask for accommodations, and your employer has to try to reasonably accommodate you. For example, maybe you should, if you have that kind of job, maybe you can work from home, or maybe you can work on a modified schedule. You can come in when there are less employees, or if they put plexiglass or move your desk away or move you into a different office. These are certain things that the employer they have to look at to give you a reasonable accommodation. My next question is, my child's school is closed and I need to stay with him or her. What paid options do I have? So you can first ask if you can work from home and maybe have a modified or a work schedule. Maybe you can switch off with someone else to watch the children. You can do that. But if that's not an option, you're eligible for the 2 weeks paid time off and then the 10 weeks at 2/3 of your normal pay. And then you can use the New York paid family leave for the 10 weeks. In 2020, it's 10 weeks. It's 12 weeks in 2021 at 60% of your average pay, up to $840 a week. And then you can maintain your health coverage and then return to work when your leave ends. Under the New York City paid safe, sick, and leave law, you can take 40 hours of paid leave. And under the FMLA, you can take 12 weeks of unpaid leave. And then your job is safe. They should not let you go during that time. You should be able to return after your leave is over. And those are the same options. For the next question, what are my options if I need to take care of a family member who has COVID-19? So it's the same exact options, the same, you can still take the 10 weeks, the 2 weeks of full-time, 10 weeks of 2/3 pay. You can take the 10 weeks under the New York paid family leave and the 40 hours under the New York City paid safe and sick leave law. You can also ask if you can work remotely. I don't think coming in on a modified schedule will work because you're staying home to take care of someone who has COVID. So they probably don't want you back working around others. The next question I have is, what can I do if my employer retaliates against me for using my sick time? So under OSHA, under the FMLA, under the FFCRA, they are not allowed to retaliate against you. You should be able to use all the time that is allotted to you. You can file a claim against them for violating OSHA laws or the FMLA or the FFCRA. New York labor law also protects employees from retaliating against an employer for disclosing unlawful conduct that creates a substantial or a specific danger to public health or safety. So if you feel that your employer is not practicing social distancing or not being safe with due to COVID, and you report it, your employer is not allowed to fire you or cut your work hours and not cut everyone else's. That's a retaliation. Is my employer allowed to fire me because business is slow due to COVID? Yes, your employer can let you go. We are in an at-will state where your employer can let you go for any reason except for discrimination. If you feel like it's discriminatory, then you can file a claim. But if you're a contract worker, if there's a contract, there should be terms of how or when your employer can let you go. If you're a union worker, there may be a collective bargaining agreement that specifies the terms of your employment. So your employer will have to work along those lines. So those are the questions I have. Perhaps you have some questions for us.
So,
Sorry.
no, I was gonna say.
I was just saying that we don't have any questions in the chat yet.
I had also asked, but I think that some of the questions that just in terms of thinking about people who might catch this on the replay, I think some of the other questions that sometimes come up in at least in the office has really been around the idea that what are the protections that I can think about now, thinking about the school year. A lot of our families are parents who have children, and then they're thinking about kind of as things come up, whether it be kind of testing or needing to take off because the child's school is closed, like those intermittent kind of things that we'll see. Where does that fall in what they're protected against, or what they have protections or rights for and what they don't?
So that so when we take time from the FMLA, the 12 weeks unpaid, which is not ideal, you don't have to take it 12 weeks consecutively. So and then the other provisions, you don't have to take them consecutively either. So what might happen is your child's school may close down for a few weeks. You can take the few weeks based on what you're eligible for, because a lot of these are even part-time workers. So New York State really did a good thing where because the FMLA, you have to be working for 1 year. A lot of people don't stay at their job that long or working 1,250 hours for the year. And that's a lot of hours. But some of the other acts that I mentioned, you can be part-time as well. And you can take the leave a week at a time. I was thinking it'd be a good idea to switch off with maybe a spouse or someone who can help out. So you take a couple of weeks here and there, and then you let someone else help you out. Because if the school starts in September, maybe around September 8th, and let's say they shut down in October, and then there's no telling when they'll open up again. So you might want to create some kind of schedule where you're not taking, I guess you could take your 12 weeks, you could take 10 weeks. It can get you to maybe about 25 weeks or so. But I mean, I guess 25 weeks seems to be a lot, but you don't have to take it all together at the same time.
Mm-hmm. Thank you. I'm just looking to see questions. Tyra, do you mind talking a little bit about what you've been able to share a bunch of different resources for people, like all consolidated, maybe just in terms of keeping up with as things change, like what are your go-to resources that families, other than this replay, right, that families can go to if they're needing some newer information update? We of course have our resource guide, which is always updated, but just other things that you think that would be helpful for families to have in their brain.
So, I mean, I think a lot of times it depends on what the needs are. So if it's food, and you're in Long Island, then Island Harvest is a great place to go. If you're in the City Harvest. Of course, if you're in the 5 boroughs, 311, they are the gatekeepers of everything. So you can more or less call 311 and get, say, I need food, I need this, I need that. And they can kind of lead you in that direction. But I think, it's a struggle sometimes in Nassau and Suffolk County to find as many resources as you can for city residents. And that's, again, just a systemic issue. But I would say that, for food, Island Harvest is a great place to go. I would say if you need help with housing, it's going to be Nassau County DSS. But again, I mean, if there's, questions or anything like that, we can kind of lead people in the direction of where they need to go. In the resource guide, there are some great resources for education. So keeping your kids busy, if they are home at some point, like Curlan said, if schools close down, come October, November, when the weather kind of cools down, there are some great resources in that guide to kind of keep your kids busy with school, keep them learning, especially since most of their school year last year was virtual. So if you want to make sure that your kids are keeping up and that they're not falling behind, there are so many resources that have been created in a response to COVID that you can find videos on YouTube. The Bronx Zoo was streaming, and they were doing stuff on environmental science and teaching kids about animals and different habitats. And so if whatever your child's interests are, there's so many things that you can find now. The Khan Academy is great if, there's tons of resources on there as well. So I think right now for families going into the fall, it's going to be a lot of educational stuff. And, until we get our next economic relief bill and, we get a little bit more money for unemployment, I think really food, housing, and some of those more basic necessities, are going to be what the needs are. I know for a lot of people, the savings are dwindling, and without that extra $600 a week, things are going to get really tight. So there's tons of food resources in there. And if I find more, I will always share them. But yeah.
Actually, I have a question, if you don't mind. For a lot of people who are unemployed, they've also lost their health benefits and health insurance. So whether it be prescription assistance programs, managed Medicaid, what are some of the options, and your resource booklet, do you comment on that as well?
So yeah, in the guide, if you've recently lost your health insurance as a result of losing your employment, There are resources in there, people that you can contact for Fidelis and for Health First, I believe. There's also some other information in there about for Get Covered NYC, where they have specialists that will kind of walk you through the New York State marketplace and kind of help you find a plan that's appropriate to your needs. I know that they did extend the deadline. The last time I checked, it was until August 15th. I'll look again to see it was first June, then July, and then August, and they kept extending it by a month each time to ensure that everyone had time to kind of get covered. But there are some resources in there, especially if you've lost your insurance due to losing your job. At least you can pick up health insurance in the interim.
I know this is an expensive option, but there's COBRA, and New York created Mini COBRA. So you can opt to pay for the health benefits that you were getting at the job for 18 months, and then New York extended it another 18 months. So you can get it for 36 months, although we know COBRA is a little expensive, but it might be a good option for you if you're, it buys you time to find something else.
I actually have 2 questions.
Oh, great.
No, that's just me asking these questions. The first one is, what about if you're working and you don't necessarily have enough money to say pay for the insurance that your organization is offering? So maybe for a brief time that you might not have insurance, but then you get COVID or you fall sick during that time, what options are available to you?
So I know, I'm not sure if Carlan knows more about this than I do, but I know on the marketplace, you can get insurance for free. So if you're not working at all, or you're making not a lot, I believe it goes by your income level. So you can find insurance that is affordable, that's either low cost or no cost at all. And I have the number. I will try to see if we can post it maybe in the chat for the New York State marketplace, where you can call directly and get low cost or no cost health insurance. So for those who are worried that they may not be able to afford it, it's definitely worth looking into, because it potentially may end up being free, and then you may be covered.
And for those who don't have insurance because of maybe immigration status or something, you should always just go and you can go to the emergency room, and definitely for COVID related issues, they should be able to treat you even if you don't have insurance.
Okay, thank you. And the other question is, Shari just said that there is a sliding scale at clinics like 865 Northern Boulevard. So maybe people can check this out too. And the other question I have is, just recently we heard Donald Trump put in this law about international students and also individuals with H-1B. So do you guys have any information for those who might be on H-1B who probably lost their jobs, or for international students who were probably on OPT and they sort of lost their jobs because the organization had to, close down? And I believe international students have about 30 days or 60 or 90 days perhaps up until the point that they could leave the country. So if a student is in that situation right now, or on the verge of losing the H-1B status, what information would you have for them, or where could they get the necessary information to probably fight the case, or get support from a lawyer or something?
So that's definitely immigration law. So they would want to, in the city, there are many immigration legal aid assistance. So I don't have the links, but if you search online for free legal immigration help, you'll find some free in the city. In New York City, they have a lot of immigration assistance. The MLP has an immigration lawyer that guides people, and you can also, legal aid can also assist you with your rights for immigration. I thought that, because I know that there was a rule that if the students weren't, if international students weren't taking in-person classes, they couldn't come. And I thought they changed that to where now they can, because I know a lot of the colleges were fighting that. So some of the colleges are allowing, because they do have in-person courses, a lot of the colleges are allowing international students to come.
I'll also add that if you live in the city, or if you go to any of the H&H hospitals, they do have legal health, which is like, I guess, our version of the MLP, where they have attorneys that are co-located in some of the H&H hospitals. So like Queens Hospital, King's Hospital, Gouverneur, Harlem Hospital. And so they also have immigration attorneys, as well as they help with a lot of other areas of law. So that may also be an option as well.
Thank you.
So I know that a lot of times when we talk about health and we talk about, employment and COVID protections, a lot of times we think about our physical health. I just wanted to kind of make sure if we can just talk about, people who are experiencing new symptoms, whether that be depression, anxiety, or other mental health systems. Can you just either clarify how those sit under the law or those acts, as well as just resources, just in terms of protections? Do they have to see someone and get verification? Like, what are some thoughts around that for people who are experiencing new either mental health issues that are coming up for them during this time period?
So as a social worker, I'm always an advocate for mental health care. I will say, if you are experiencing anxiety or any feelings as a result of COVID, which I think we all have to some extent, but some more than others. And so if you fall into that category, I would implore you to seek mental health care. And sometimes that may not always be the traditional route of, I go and I see a therapist and I talk for 45 minutes once a week. It may be more situational anxiety in nature. And it may be that you just need to talk to someone for a short period of time until your symptoms or your feelings kind of settle. And so I know that in response to COVID, New York State Office of Mental Health launched a emotional support wellness line, where they have a licensed mental health practitioners that are there available 24/7 to talk to you, to support you, that can also refer you to local resources if you want to continue treatment or you're looking to get into treatment. They can find, wherever you're living in New York State, and they can refer you there. They also just started this summer, it's called Coping Circles. So it's led by a licensed clinical social worker, and it's a group of 6 peers with 1 therapist, and it lasts for 6 weeks. So it's group therapy. If you're comfortable with group therapy, Coping Circles is a great option. Again, it's offered by New York State Office of Mental Health, and it's free services. Also for New York City residents, they have New York City Well, which is a great, resource as well. It's 24/7. It's licensed mental health counselors that can talk to you, and that can also refer you to longer term care if you're looking. If you live on Long Island, the Long Island Crisis Center is a great resource as well to call for counseling or to get connected to something in your community. Let's see. Also, I know recently, if people are interested and they have insurance at this point, and they're interested in more virtual therapy, because maybe going into someone's office is not something that they're really wanting to do at this point, platforms like Talkspace or BetterHelp are an option. Talkspace just recently launched, they're now accepting insurance, which is something that they weren't before. They offered various payment plans that can still be out of reach for a lot of folks who need those services. So now they're currently accepting insurance where you can chat or video chat with a therapist. So if that's something that people are into texting and you feel like texting a therapist, and then I think you can alternate between texting and video calls. You can double check on their website on Talkspace. They can verify if your insurance offers a behavioral health component that meets their criteria, and you can potentially have that covered by your insurance and just pay your copay. So there's tons of options, free and with insurance, for folks who are experiencing anxiety, depression, social isolation. Those are all completely normal feelings to have given everything that we've just gone through. And for some people, you know, it may be more of a delayed reaction where it may start to kind of come out now that we're a few months into this. So there's lots of stuff out there for people if they are looking.
And I'll just add that if you take FMLA, you do have to see a doctor, but the Department of Labor has changed that you can use a telemedicine visit for FMLA purposes. It just the healthcare provider has to perform an examination, evaluation, or a treatment. It has to be a video conference, and if it's permitted by the state, and it is in New York. So if you want to use, and it could be non-COVID related. So if you want to use telemedicine to help with your FMLA claim, it's accepted now. So you should do that if you need to.
Hey guys, it's Sherry. I just wanted to also add in quickly around dental health. A lot of times, like, dental health is not covered by Medicaid, Medicare, etc. And so there are dental resources that are also on sliding scales at most schools of dentistry. So if you contact a school of dentistry, for example, NYU has a school of dentistry, you can usually get into their clinic and they can see patients for, you know, cavities or things like that. Whereas if you usually go to a hospital and you don't have dental insurance, they will often pull the tooth versus try to save it. So just a little more information.
Well, I think that this has been really eye-opening. I'm really excited to see kind of how people can share this information, because I think a lot of this exists in different places, but it's been really great to kind of have it all in one space. And so definitely, I think people should also feel free to kind of share this and share this information, share where we are, because this will be staying up here for a very long time, and for people to get that information. Maya, I wanted to throw it back and just make sure, were there any other questions? I hope that we've gotten to a lot that you think your listeners and audience would benefit from.
There are currently no questions available in the chat. But one of the things that the audience would benefit from is that we try to tie in as much as possible the link between the health disparities that exist and probably health disparities and maybe how that could tie into work. And especially with now that we have, you know, around the time that George Floyd, you know, he passed away, there were many people who were not feeling safe talking about these sort of things at work. And even now, like, a lot of people were talking about, you know, being discriminated against and how that could affect their health. Like, what information now is available for, like, Black and brown people? Like, how are we protected in the organization other than, like, say maybe EEOC laws that people don't know about? Like, some people are unaware that you could wear your natural hair in the workplace. And so, like, probably tying that in and letting people know what their rights are in that regard. If they're fed up and they do not want to come to work on that day, are they protected to say, like, hey, can they stand up at work and say, hey, I'm discriminated against? You know, what can they do and what laws are there to protect them?
So you definitely have the EEOC. It's like one of my top go-tos, and also the New York City, what am I saying? The human rights law of New York City. That's really a good, if you want to bring a discrimination claim. Now, someone might say, how do I know if I have a discrimination claim? If you're being just treated differently. If they let someone take a day off or take a week off and you ask for it, and there's no reason for you in particular to be in the office, it might be discrimination. If they're telling you about your hair, but they're not telling someone else about their hair, it might be, if you're just being treated differently And what I always tell clients is to keep a record, keep your email. If you're sending emails back and forth, just keep a record of it and make sure you have it somewhere else. So that when you do need to pull it up, if you got fired, you probably won't have access to the emails on your job system. You need to make sure you keep a record of all these things. Write things down and, who you spoke to. If you do see a problem, the first thing you should do is you talk to HR, because we don't run headfirst into a lawsuit. We ask, well, what did you do? Did you alert HR? You have to give them an opportunity to fix the problem. If you don't give them an opportunity to fix the problem, the EEOC, that's how we bring a lawsuit. You can either bring it to the human rights or you can bring it to the EEOC, and then they give you the opportunity, if they feel fit, to sue. So we always have to go through them first, but they want to know what you did in order to try to get the problem rectified. So they always want to know that you alerted HR, you tried your best to have the problems rectified. So I told my manager, didn't do anything. I wrote an email to HR, and always keep it like that. Try not to do it over the phone, because then someone can say, well, she never calls me. I don't even know what she's talking about. Send an email and document what's going on. And then you can take these things to a lawyer and say, I feel like I'm discriminated against. A lawyer will be much more likely to take your case if you have some documentation that they can use to take it to the EEOC. What happens at the EEOC? So the EEOC, your lawyer or you can do it yourself. It might be easier to have a lawyer, but you can definitely do it yourself. You can just write down what happened. The EEOC sends your complaint to your employer. Your employer has to respond to it. Then the EEOC sees if there is a justifiable complaint. If there is something there, they invite you into the offices. Maybe it's probably via Zoom or Skype now, but then there is a mediation. You're in one room, your employer is in another room. The EEOC lawyer goes back and forth to hear what was going on. And usually there's a settlement. So you say, well, I was injured this amount because I got fired and I didn't work for 2 months. So I was injured this dollar amount. And then, they go back and forth. If they're not able to solve the problem, if you're not able to settle at that point, the EEOC may take that case themselves and sue the employer, or they may give you the right to sue, then you can sue your employer. So there are many steps to doing it, but you have to be diligent, you have to pay attention. And like I said, you have to be being treated differently. So if your employer is just a jerk to everyone, that's not discrimination. You just have that kind of employer. It has to be you for a particular thing that makes you different.
Okay, thank you for that. And one more question, because it's 8:55 and we're about to be wrapping up. A lot of times we have patients who come on here, or patients who are listening, and they believe that they have been treated differently when they go to the workplace. So take, for example, at the beginning, and even probably now, a lot of Black and brown patients were going to the hospitals and being turned away, only to find out that we're most disproportionately affected by COVID-19. And we do have a question now, so I'll stop my question. I was just about to ask about patient rights, but it's not just discrimination, but retaliation. And the individual asked, what protections do folk have after filing for discrimination?
What protections do they have after fighting for discrimination?
Yes.
So there's within the EEOC, within all those laws that protect us, your employer cannot retaliate against you. If they do, they end up having to pay you more money for the retaliation. They're the whistleblower laws. If you report your employer for anything like discrimination or violating OSHA or anything like that, they cannot retaliate against you. How do you know if they retaliate against you? All of a sudden you get less hours and the business is doing well. Your office gets put somewhere else for no apparent reason. You document that and you bring a retaliation claim. So there are many laws. Each law that so you have the EEOC, you have even these laws that we said to take leave, they have laws against retaliation because sometimes employers can be a little vindictive.
Okay, thank you. So just I was going to ask the question about like what are the patient's rights, and can we briefly tell patients what are their rights when they go into the hospitals and how they could advocate for themselves, especially as minority patients.
I wanted to say a few things about that. So I think there's multiple things that we just need to be kind of aware of. Unfortunately, as people of color, in terms of like those rights. So basically things that I would consider underneath that would be the interpreter services, that you have a right to that, and that's really important for anyone who's like limited English proficient. Also, another big thing is kind of emergency messaging and ensuring that, you know, that you have that access to information, like when you finish your visit, and just making sure that all of those questions are actually answered. You also have the ability to ask for, usually there is a patient resource individual who is in the clinic that you can ask for if you feel like you are not getting that adequate care. And so I think a part of it, unfortunately, is that their expectation should be that care should be given equally. But then in addition, I think even as a Black physician, that same idea of making sure that I know what I have access to, and also knowing that I have the right to demand that, and the things that I need, and understanding what, either if I'm being sent home, why is that not, and also being able to have the patient representative come and explain that, and be able to be a liaison between me and the provider if there's difficulty in communication or barriers in how that person is communicating to me. I think those are some of the things that come to mind for me, but that is not from a legal standpoint. I'm not a lawyer, so I don't know. Carlan, if there's anything else that you wanted to add.
No, I think that's good. I think that you have the right to be treated. You have the right to be treated like everyone else. I'm not particularly too familiar with the exact law that would, what the cause of action would be against a hospital if you feel like you were discriminated against there. There could be a claim for discrimination, but if you feel like you're not getting the right care, I would go with what resources are available to you, or request a liaison, or request better care.
Well, thank you so much, ladies. This was such a wealth of knowledge. I want to say thank you so much to our legal director for the Medical Legal Partnership, Carlan Flowers, JD. I also want to thank you so much, Tyra Bustigo, licensed clinical social worker, who is a social worker at a couple of our sites, partnering with the Medical Legal Partnership. I also just want to thank our group. We have some other people that came on that didn't get a proper introduction. I'd like to say Dr. Shari Jardine I'm speaking it into existence because she's working on her PhD. Thank you for those jewels that you dropped. And of course, last but not least, you can never forget my girl, Dr. Omolara, who is amazing. So thank you all for everything that you've done this evening. And I just want to say next week we'll be back, September 3rd. We have Black business owners, where we're going to be talking about how do you sustain a business or even start a business? Because a lot of people, speaking of unemployment, have used this time to actually launch businesses or reinvent their business. So we have 3 fabulous business owners from the area. We first of all have, and they're all actually from Queens, which is to me the greatest place on earth. So we actually have the CEO of Hella Cocktails, who I actually used to work with at Modell's in high school, Mr. Jomari Pinkard. He actually was in an American Express commercial, so that's kind of a big deal. So we have him who will be on next week. We also have from the Shop Beauty Bar, licensed cosmetologist, also Dudley's distributor, Chantel J. And last but not least, the people that are making me fat this summer, Sydney Sweets. That's Jermaine and Sydney Perry. who owns Sydney Suites out in Hempstead. So I'm looking forward to next week's show. We look forward to seeing you. And again, thank all of you tonight for what you did. We had Dr. Williams and myself, of course, Ms. Busigo, Ms. Flowers, Ms. Jardine, and again, last but not least, our girl, Dr. Omolara Udoweche. Thank you guys. Have a good night.
Thank you. Bye.
Thank you. Have a good night.